Good evening, everyone. Hello, bonjour, quoi. We're going to get started, so thank you all for being here. I want to begin today's meeting by taking a moment to reflect on and to acknowledge that the space we occupy today is on the unceded traditional territory of the Algonquin and Anishinaabe people who lived and continue to live on this land. I would also like to recognize and honor the valuable contributions of the First Nations Inuit Métis people who call this land their home. When we acknowledge the land, we remember unceded means that First Nations people never ceded or legally signed away their lands to the Crown or to Canada. When we speak of traditional territory, we speak of land they or their ancestors traditionally occupied and used. This land sustained them, and as stewards, they cared for the land and the waters that flowed through them for generations before their lives were irrevocably changed through colonization and forced assimilation through the residential school system. In the spirit of true reconciliation, as chair of the Board of Health, I have committed to continuing my own learning journey with ongoing training opportunities as they become available. And I ask you, my colleagues, to reflect on your continued action to support Indigenous health equity and self-determination of all Indigenous peoples. We will now conduct the roll call, please.
Member Banham?
Present.
Member Bauer?
Present.
Member Brown-Shaves? You're muted, member. We're not hearing her now. Yeah, she's there. Member Carr?
Present.
Member Chung? Member Dudas? Member Gower?
Here.
Member Kavanaugh?
Present.
Member King?
Here.
Vice Chair DiGiovanni?
Present.
And Chair Kitts.
Here. Thank you. No regrets filed today. Do we have any declarations of interest? Seeing none. Confirmation of minutes of the meeting of December 4th, 2023. Are these confirmed? We have 3 communications items that have been received. Motion to introduce reports. Member Dudas, please.
Chair, be it resolved that the confirmation of the Chair and Vice Chair for 2024, the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, the verbal report on the education session regarding voluntary mergers, and the reports titled Indigenous Health, Rights and Reconciliation, Annual Update in Attendance at the Association of Local Public Health Agencies, Alpha Winter Symposium be received and considered.
Is that carried? Thank you. Okay, we will go through the consent agenda. So item 7.1, confirmation of the Chair and Vice Chair for 2024. Is that carried? Great. Item 7.2, it's Chair of the Board of Health verbal report. We will hold. Item 7.3, Medical Officer of Health verbal report. We will hold. Item 7.4, 2024 draft operating budget for the Ottawa Board of Health. That will be held for a verbal report as well. Item 7.5, Indigenous Health, Rights and Reconciliation Annual Update. We have presentations on that item, so will be held. And item 7.6, attendance at the Association of Local Public Health Agencies Winter Symposium. Is that carried? Great, thank you. Okay, so item 7.2 is my verbal report. So good evening again to everyone. Thanks for joining us. It's my pleasure to welcome you to the first board meeting of 2024. And I would like to begin by recognizing that February is Black History Month. It's an opportunity for us all to celebrate the past and present accomplishments of Canada's African, Caribbean, and Black communities. It's also time for thoughtful reflection about the significant health and social disparities that still exist due to anti-Black racism. Au nom du Conseil, je tiens à profiter de cette occasion pour réaffirmer notre engagement continu d'intégrer l'équité au cœur de tout ce que nous faisons. Health equity ensures that all members of society have access to the educational opportunities, economic conditions, health and social supports, as well as healthy places to thrive. Achieving these objectives requires all of us to acknowledge the systemic barriers that remain a daily reality for our Black friends and neighbors. Only then can we work to reduce the disparities in health outcomes that they face. I know this is not only a public health issue, but also a deeply personal mission for many of us around this table. And as an ally in this cause, I invite all board members to engage in discussions and participate in events that build understanding as well as appreciation for the experiences of African, Caribbean, and Black communities in Canada. Last month, I attended the Rural Ontario Municipal Association Conference in Toronto. C'était une excellente occasion de rencontrer d'autres dirigeants de municipalités rurales et de petite envergure et d'échanger sur nos priorités communes. I also met with a number of provincial elected officials to convey the board's positions on key issues that have remained on our agenda over the past year. They include the need for additional provincial investments to address Ottawa's overdose crisis, as well as increased investments in the Healthy Babies, Healthy Children program to respond to the growing number of families who are dealing with increased cost of living, precarious or underhousing, as well as other aftershocks of the COVID-19 pandemic. I also had occasions to engage with members from other boards of health across the province and hear about the exploratory discussions they are having with one another about voluntary mergers of public health units. I look forward to providing board members with a more detailed report regarding the voluntary mergers of public health units later in tonight's proceedings. Finally, I'm delighted to share the news of a long-term provincial investment that will enable our city's children and teens to be better protected from vaccine-preventable diseases. Thanks to additional funding from the Ministry of Health, Ottawa Public Health will be able to maintain its partnership with the Kids Come First health team to vaccinate the growing number of under-immunized children who don't have access to a family physician or nurse practitioner. Ce financement annuel offrira à Santé publique Ottawa les ressources stables et prévisibles nécessaires pour maintenir ces cliniques de vaccination basées dans les écoles et dans la communauté. On behalf of the board, I want to thank the Ontario government for recognizing this ongoing need to ensure the health and well-being of our children and families. This concludes my verbal report, and I would be happy to take any questions. Seeing none, is this received? Thank you. Item 7.3, Medical Officer of Health Verbal Report. Over to you, Dr. Etches.
Sure. We're making good time to hear from our delegates tonight, which is great. So good evening, Kwe, Unasukut, Tanshe, Annie, bonjour. I think it's not an understatement, or it is an understatement, sorry, it's not an overstatement to say that the last year has again taught Ottawa Public Health the importance of being flexible, of really working in partnership. Certainly we continue to see how much the pandemic has affected the health of our community in many ways, not just through infection. We are continuing, of course, to work with Indigenous and non-Indigenous partners to address these evolving needs, and so we've heard about some of this work, which is about addressing racism, discrimination at the systemic level. We see the inequities in who is facing food security in our community, the shortage of safe and affordable housing, and growing mental health concerns. So I am thankful that we have representatives joining us today from the Ottawa Aboriginal Coalition, Minwashin Lodge, Kausavik Inuit Family Health Team, Inukarigit Center, and the Canadian Center on Substance Use and Addiction to describe more of what they think is important we consider. And I do want to say at this point, of course, how much I appreciate that you made the time to be here and to share with us and our ongoing partnership. Je suis très reconnaissante d'avoir partagé vos connaissances et votre sagesse avec Santé publique Ottawa, alors que nous continuons à renforcer notre partenariat avec vous, fondé sur la reconnaissance des droits et de l'autodétermination des Autochtones. So thanks. I want to thank some of the staff who are contributing to this work. It's always hard to know who to thank at these meetings because, you know, we have so many that are behind everything we do. It's not me. But because of the subject of the main report today, I do want to recognize Kim Trotter, who's consistently demonstrated the principles of respect, reflection, reciprocity, and relationship building with partners. I want to specifically recognize Rob Chief, who's brought his expertise over the last 3 years to support the team's work. He's been instrumental in shaping the training and curriculum, which I know most around the board table have experienced, as well as you may not have realized it was his artwork behind some of our work to engage Indigenous partners with more culturally appropriate communications. And I know it's not a short report, it's a long Indigenous health rights and reconciliation report, but I think a rich piece of work for educational material as well, to be shared more broadly with our team. And in that, there is a document, an appendix about the youth sharing their perspectives, and Rob really supported that to come forward. And now joining Rob and Kim on the Indigenous Health Rights and Reconciliation team are 2 new Ottawa Public Health team members, so Raven Cottenham, who's in the room, and Deborah Tagomak. So we thank them for joining, and as we have embraced growing team in the new year, of course, want to just continue to be committed to this work with all of you. I think we can save other comments. I'll just go on to really talking about some other things that are the volume of infectious diseases, and of course, recognizing the tragedy of lives impacted because of drug overdoses. So, in terms of catching children and youth up on routine and school-based vaccinations, we did see that was one of the effects of the pandemic. There was significant disruption in access to vaccinations, and this reemergence now of vaccine-preventable diseases like measles. It's happening around the globe. We hear about that, and here we're working to make sure with partners like Kids Come First to make sure children and youth catch up on their routine vaccines. So to say that this is offered now access to routine catch-up vaccines in those neighborhood hubs where children and families might have additional barriers, and also through our rotating community clinics. So we still have points of access in the east and the west and centrally, but only one site is open per day now. That's how we're operating with fewer staff, rotating those. And we're also planning this year to continue to go into schools, holding clinics in 46 elementary schools, which is after school, open to the whole surrounding community, and then in high schools where it's for those students in the school, about 26 high schools this year. Pour 2024, l'une de nos priorités est d'identifier des moyens de surmonter les obstacles à atteindre de niveaux plus élevés de couverture vaccinale contre le virus du papillome humain, qui prévient plusieurs types de cancers. So I am concerned in particular that children born in 2007 and 2008 have not yet caught up to reach pre-pandemic levels for the human papillomavirus, where we would typically have seen about 67% immunized, and really that level too needs to grow. We would like to see a rate of 90% of people immunized to prevent cancer. So we'll continue, and we'll keep looking for more capacity. In terms of COVID-19 and respiratory illness, the season is still months from ending, and so Ottawa Public Health continues to recommend that people consider their risks and those of their loved ones around them and use your layers of protection to reduce transmission. Currently, COVID activity is moderate and wastewater levels are decreasing. Influenza activity is high and RSV activity is moderate, which are both similar to last week. Vaccination for COVID-19 and flu does remain the best way for residents to protect themselves from severe illness and hospitalization, and it's not too late to get those vaccines at your local health care provider or pharmacy or even our clinics. And additionally, I do encourage people with symptoms to stay home, to refrain from visiting loved ones in hospitals, long-term care, retirement homes, especially when ill, and washing your hands often. So please visit people, but especially don't visit when you're sick. And then to cover your cough, of course, and your nose when you cough or sneeze. So, de plus, j'encourage les personnes qui présentent des symptômes à rester à la maison, à s'abstenir de rendre visite à leurs proches dans les hôpitaux, les foyers de soins de longue durée et les maisons de retraite quand vous êtes malade, et se laver les mains souvent et à se couvrir la bouche et le nez lorsqu'elles toussent ou éternuent. Please consider wearing a mask for those 10 days when you're recovering from illness after you have COVID to reduce spreading the infection to those around you. And Ottawa Public Health, concerning helping people understand whether it is COVID that they have, had answered the call to support the ministry in distributing the free COVID-19 rapid antigen tests. We have distributed, thanks to the team again, more than 825,000 test kits to more than 120,000 masks through our 40 locations across the city. So it's it's been quite a logistics project. That will wind down at the end of March as that provincial funding is ending. And of course, we are continuing to respond to the evolving needs of our community with our base funding. So the work will continue, will include ongoing surveillance. Ottawa Public Health will continue to provide weekly, year-round reporting related to COVID-19 as well as other respiratory and enteric infections. It's actually since December 2022, you may remember, Ottawa Public Health has been integrating our COVID-19 data into the reporting on respiratory and enteric illnesses, our surveillance dashboard for overall. And we find this is a unified source. We've enhanced the visual appeal to that, and we've been able to show really the current trends on that site as well to help inform people's risk assessment. It guides decision-making and protective actions for the public, but also in healthcare settings where we want to help people understand when the masking needs to be enhanced. So we'll continue to raise awareness year-round as COVID looks like it isn't going away. For the general public, of course, avoiding COVID infection is important, or COVID reinfection, because there can be long-term complications, and there are people around us who are more susceptible to severe illness. So again, we'll continue to let people know as different vaccination recommendations come as one of the foundational aspects where people can get antiviral medications, and to continue to use those layers of protection, including masking, and we'll continue to have information on our website. So continuing with the topic of infectious disease surveillance, we have seen a sharp rise in the number of people that have invasive group A strep infections. It's also been in the news, so probably not a surprise, but to share with you the number more than doubled to 145 people with invasive group A strep compared to the pre-pandemic average of 69 people annually. So this is similar, again, trend across the province, nationally and internationally. So we issued an advisory last December to local hospitals and healthcare partners requesting that they be on the alert for complications from group A strep infections and consider it as a cause of severe illness. All cases of invasive group A strep are followed up by our team of those nurses who do close contact identification and have conversations with people to identify whether they need to have antibiotics following an exposure. We follow provincial guidelines and help people understand when they might need to get more assessment. And we've also been sharing information with the general public in collaboration with our partners to help parents and others understand when and where to seek care. We'll continue to monitor the situation and provide updates. Another trend, not unique to Ottawa, but quite concerning, as you know, is that we have seen this dramatic increase in harms due to drug toxicity, fatal and non-fatal drug overdoses. And so we're seeing that the demand for mental health and substance use health services has never been higher. Existing levels of funding simply aren't meeting the urgency, scale, and intensity of this unprecedented need. And so we are continuing, therefore, to collaborate with many partners to explore how we can be innovative with the resources we have, how we can collaborate to close gaps in care across the continuum of care, from prevention right through to treatment. I have been meeting with neighborhood associations, and we've been looking at, mechanisms to make sure that changes and shifts in services and supports are informed by diverse communities. The options currently underway with support from many partners, we're part of this work. We're not always leading. Sometimes we're convening in the background. But there are things like increasing capacity for quickly starting and maintaining people on treatment, developing alternate points of care so that people don't have to go to emergency departments. We're really looking to provide people with more rapid access, not only to crisis response services, but also ways to connect people to a wider range of trauma supports and treatment options. And of course, I'm also connected to the City of Ottawa's work on housing and other interventions that we know can make a difference. Je tiens à remercier le président de notre conseil, Catherine Kitts, qui a informé le gouvernement de l'Ontario au nom de le conseil. So the chair has been discussing the need to improve access to community-based supports and services, to improve community well-being when it comes to mental health and to address substance use harms. So I want to thank you for that. And as part of Ottawa's overdose response strategy, we're working with all of those who are part of the Overdose Prevention and Response Task Force. You might remember last year we launched a course, sort of e-training called Party Safer. And due to popular demand, unfortunately, the need is there. We are expanding our training to include another course called Overdose Prevention and Response. So this will be a self-directed 20-minute course online, and it's mainly targeted to people who are school staff, business owners who are wondering what to do, healthcare professionals, and community center and social services staff who can interact with people who may need more support. To provide that essential information on overdose prevention, naloxone administration, which I thank you. Some of you took that training today to be better prepared. It includes steps on responding to an overdose, but also how to support debriefing and connection to additional supports. So information on mental health and harm reduction and substance use health services so that people can be linked more easily. So this training will be on that Stop Overdose Ottawa page that we maintain on behalf of the task force. We're also looking to use that forum to enhance our local drug alert and advisory system. So something that would take information in a timely way and really, as you know, we have trend information about hospitalizations and emergency room visits, but we're looking to add information on local trends in drug toxicity. Similarly to what we did with the public service announcement, where we let people know that we're concerned about the drug supply, not only having opioids, but having contaminants and benzodiazepines that don't respond to naloxone. So we'll share more of that when the alert system is started. So finally, February is Black History Month. Thank you for speaking to that as well, Chair. It is an opportunity for all of us to learn more, not only about the history and the contributions of Black people in Canada, but about the experience of countering systemic racism that exists to this day. And as we celebrate the advancement and achievement of Canada and here in Ottawa's African, Caribbean, and Black communities, we also are taking this as a time to reaffirm our commitment to become a culturally safe and anti-racist organization. There are Black OPH team members leading this anti-racism work. Also, Rob Chief has been involved, as I mentioned him. And I think this work is shifting expectations and accountabilities internally. We're looking how to expand that externally with partners and recognizing while they're leading, it's the work of all of us. So we have individual responsibilities and collectively as an organization responsibilities to champion this work. The Health Equity, Diversity, and Inclusion team is partnering with the Learning and Development area to offer 4 opportunities this month to our team to expand their knowledge of Canadian Black history and the ways in which anti-Black racism continues to manifest within our systems and society. And also to learn about how our team, our community engagement team, is supporting participatory research with the Black community here in Ottawa. These sessions are being facilitated in a manner that's really about fostering learning and fostering dialogue across our teams to build understanding and ultimately growth and change. So I am personally thankful for Black leaders in Ottawa, including in healthcare, like Dr. Brown-Shreves, who's online, for those in academic and community associations who are helping me better understand Black experiences and who are working together to advance a Black health plan for Ottawa. Ottawa Public Health is supporting the work to get to a place where the leaders in the community and community members have articulated their priorities for a Black health plan, and we are striving to shape all of our programs with engagement across this diverse community in Ottawa. Certainly co-chairing the Ottawa Black Mental Health Coalition continues to be a valued contribution of Ottawa Public Health. Et l'équipe d'engagement communautaire continue de répondre aux besoins de la communauté en général et en particulier aux besoins des membres de la communauté noire, notamment en étant proactive dans les recherches de solutions et en élargissant ses partenariats avec les leaders noirs d'Ottawa. So we look forward to building on our collaborations to date in line with your strategy, the board's strategy. So we expect to report back to you as part of our regular strategy updates. And that concludes my verbal report. Thank you. Happy to take any questions. Miigwech, merci.
Do you want to call me or I'll just go?
Member Banna?
Thank you. I was just wondering about the Group A strep without like naming names or whatnot, but are there certain settings where it's more prevalent? Like, I know when we talked about other infectious diseases throughout the pandemic, it was maybe congregate care settings, et cetera. Could you speak more to that and potentially what the public might want to be aware of?
Thanks for the question. I think that's one of the challenges with invasive Group A strep. There are some risk factors that we are aware of, and I'll speak to that, but there are also many times we have no clear answer why someone gets invasive illness and others don't. So when we look across our experience in Ontario with Public Health Ontario as they pull together information, risk factors can include previous viral illness like COVID, influenza, chickenpox, actually, which they all disrupt the integrity of the skin or mucous membrane. So that seems to be a risk factor. Another reason to get vaccinated with your early childhood vaccines or flu or COVID. Among adults, we do see some higher rates among people who are homeless, but that isn't the only group. So, I think for children, we've been looking at it, and again, there isn't something you can say it's only in this particular population. It's infections across our community. So I think that's why my message, to everyone, adults, parents, is to remember that sometimes a serious infection can result from something that seems to start out as a regular viral illness. And what we're really wanting people to look out for is a rapid decline in people's well-being. So most parents know how a respiratory illness goes, and they've gotten their children through some of these, but when you're a parent, you also know when your child is really sick. When they're not interested in things, they're not responding, and those are the times to make sure you get to test for whether this is strep throat, and again, why we're pointing people to points of access for that evaluation.
Thank you, Member Banham. Member Chung, please. Member Chung, we're having trouble hearing you in the room. Just Give us one moment. Can you try again? Oh, still no. Just give us 1 second. Sorry about that. Okay, go ahead.
Can you hear me now?
We can.
Yes, okay, great. Thank you. Thank you, Dr. Etches, for your report. It's always great to hear about all the work that OPH is doing. I was just wondering, along with the mention of rise in eye gas infections, just wondering about measles infections, and if you're tracking, if OPH is tracking them, any kind of efforts to promote awareness of the increase and public management of it.
So thank you for your question. Concerning measles, we do have, measles is obviously, it's one of the reportable diseases, so any cases are reported to Ottawa Public Health, and we have a report of all of the reportable diseases by year on our website. So there's historical information about all of these infectious diseases and how often we see them. We have been using venues like the board meetings to try to raise awareness that this is a risk. The last cases of measles we had in Ottawa were in 2019. And at that time, like we would see, because measles is eliminated in Ottawa, in our country, typically it's that they start with a travel-related cases that's been imported. And then if we have high levels of vaccination, we don't see spread locally. And that was typically what we would see. There would not be spread locally. In 2019, I believe we had a little bit of local spread. And we had to follow up with, I think, 1,400 contacts or something like that. You know, it's a lot of work just for one introduction of measles, right? So this is why we're promoting catch up on early childhood immunizations. And I think the message is getting through one way or the other because we are seeing the registration for childhood vaccination continue to grow. The demand for appointments is growing in our clinics. So we continue to add appointments if people aren't able to get in as we see the demand is there.
Thank you. Thank you, Member Chung. Member Carr, please.
Thank you, Chair. Thank you, Dr. Etches, for your update. I just have a couple quick questions with respect to the information you provided on the increasingly toxic drug supply. I think you mentioned that on the Stop Overdose website that there would be more data available. Are there any specifics available at this point on what sort of data that would be? Is it just on incidences of that toxic drug with animal tranquilizer? Are we looking at overdoses that could not be reversed because of that? Is there anything that you can elaborate at this point? I realize it's early on, and then I have a follow-up question too.
Yeah, I'll turn it over to Kira Mandrick to speak to that alert system that's coming.
Thanks, Dr. Etches. Yeah, like we mentioned, it is a little bit of early days, but what we're doing, we're trying to set up a system for partners and members of the public to be able to sign up to receive alerts. So things like the PSA that we released last week. So for folks to be able to sign up and receive that timely information, and it would include sort of different trends that we're seeing in the community. So that might look like an increase in toxicity, and we're wanting to warn folks about a rise that we're seeing. It could look like drug checking results that are coming available, a new substance that might be circulating in the community that we want people to be aware of, signs and symptoms to watch out for, and things like that.
Thank you. And I think you kind of answered my second question. I was wondering about sort of if there were organizations, I know Dr. Etches had spoken about email alerts, but if there's organizations that you're working with sort of more at the level for street-involved people who may not have the same access to health resources as others, if there's anything that you can tell us about the plans.
Exactly, yeah. So really wanting to make sure that we're getting those key messages to the folks that are using drugs and most at risk. So working with shelter providers, drop-in providers, people that are providing outreach services, so that we're able to get that information quickly to them, for them to be able to disseminate it to folks in need.
Okay, thanks very much. And I look forward to following the updates on this. Thank you.
Thank you, Member Carr. Member Bauer, please.
Thank you, Chair, and thank you, Dr. Etches. Just a quick follow-up on measles. Do we have do we have line of sight on the gap in coverage, immunization coverage amongst children and youth? What are we trying to catch up on? Do we know if it's severe or?
Yes, we have had our epidemiology team estimate that gap in coverage based on how many measles doses we distributed into the community to primary care providers who would normally do most of that immunizing compared to historical distribution rates. So they really dropped. I think I would have to ask the team to, if they have the specific, but it's thousands, and measles in particular is a concern. Yeah.
Yeah, the estimate was at the beginning, when we started doing the catch-up on routine immunization, the estimate was about 40,000 doses. Now, that's not just measles, that's all childhood vaccination. One thing that's also important to note is that when children receive a vaccine at their primary care office, parents have to report to Ottawa Public Health. So those numbers that we have, all of our coverage rate, include both include the information that we have received. So some children may look in our record as unimmunized, but really it's because the parents weren't aware that they had to report to us. We are in the process right now of sending letters to notify parents if our records are not up to date. We're right now sending letters to children who are 7 and 17-year-old, letting parents know, so parents are able to send us the information or access the vaccine if the child needs to be vaccinated.
Thank you. Merci, Marie-Claude Turcotte.
Thank you, Member Bauer. I'm not seeing any other questions, so thank you very much, Dr. Etches, as always. Is this received? Wonderful, thank you. So we'll move to item 7.4, verbal report on the education session regarding voluntary mergers. So during my December verbal update to the board, I discussed that the Government of Ontario had announced one-time funding for local public health agencies to explore opportunities for voluntary mergers. Since then, the Vice Chair and I have been monitoring the conversations that are taking place across the province, including the Eastern region, as neighboring boards of health explore voluntary mergers. In the process, I have reached out to my counterparts at neighboring boards to understand how they are embarking on these conversations and considering different options. The Ministry of Health indicated that even boards that are not considering a voluntary merger should still analyze supplementary options for strengthening the public health system within Ontario. So to that end, the board gathered for an education session on January 26th to learn more about the conversations that are happening in our region and their implications for us. At my request, staff provided us with an analysis of various options for Ottawa regarding the governance structures and geographical boundaries that could be under consideration by neighboring boards. During this session, the board heard that this initiative is primarily aimed at boards in smaller communities and rural regions. The province has indicated that cost savings is not the intended goal of any voluntary merger. Rather, the goal is to make better use of existing assets and reinvest any savings from mergers back into expanding, improving programs to better serve people. The board also heard that here in Ottawa, the previous Board of Health took the position that there is a net benefit for Ottawa Public Health to serve its more than 1 million residents by maintaining its existing boundaries and governance structure with the City of Ottawa. The board spent the balance of the education session learning about 3 potential options for governance structures and geographical boundaries involving Ottawa Public Health. Those options included amalgamating with 1 or more adjacent public health units to create a new corporate entity, merging 1 or more adjacent public health units into the existing corporate entity known as Ottawa Public Health, and finally, maintaining the existing governance structure and geographical boundaries so that Ottawa Public Health remains a department of the City of Ottawa with a semi-autonomous board as its governing body. The board heard about the financial, operational, and governance implications of the 3 options. Several considerations were assessed regarding the potential impacts of merger options, including increasing the population served, including additional demographic and geographic subgroups, sharing existing capacity and expertise over a larger catchment area, reducing Ottawa's representation on the board, reduced administrative efficiencies, and financial risks due to uncertainties for future levels of provincial and municipal funding. From a cost effectiveness perspective, it was apparent that maintaining the current relationship with the City of Ottawa provides Ottawa residents with the greatest return on investment and the least financial risk, assuming the cost-shared funding formula between the province and municipalities is maintained. The board also discussed the value of working with neighboring boards to explore alternative service delivery models that could achieve the provincial goal of leveraging existing expertise and assets to serve local populations more effectively and efficiently. The province has asked all boards considering mergers to put forward their proposals or position in writing by April 2nd. In the meantime, the Vice Chair and I will continue to engage with the province, the Association of Municipalities of Ontario, as well as neighboring boards, and report back to all members on any new developments. At this time, I would like to invite Vice Chair DiGiovanni to table the motion for the board to consider this evening.
Thank you, Chair. Be it resolved that the Ottawa Board of Health received the verbal update regarding the Ottawa Board of Health education session, which was held on January 26, 2024, as information, and that the Chair and Vice Chair of the Ottawa Board of Health and Medical Officer of Health continue to engage with representatives from the Ministry of Health, neighbouring boards of health, and the Association of Municipalities of Ontario with respect to voluntary mergers and explore opportunities for alternative service delivery models with neighbouring health units to strengthen the local public health practice. And the Board of Health direct the Medical Officer of Health to provide an update to the Chief Medical Officer of Health and the Office of the Minister of Health on the due diligence conducted to explore possible merger scenarios by the deadline of April 2nd, 2024, reflecting the Board's preferred approach, which is to maintain existing boundaries and governance structure with the City of Ottawa. And that the Chair send a letter with a copy of this motion to the offices of the Minister of Health and the Chief Medical Officer of Health, and copy the Mayor of the City of Ottawa and City Councillors, the City Manager, and the Chairs of the Boards of Health of neighbouring health units, advising of the Ottawa Board of Health's preferred approach to maintain its existing boundaries and governance structure within the City of Ottawa. And furthermore, that the Chair of the Ottawa Board of Health report back to the Board on this matter at future meetings.
Thank you, Vice Chair. So I'll now open the floor to discussion, if anyone has any questions, comments. Seeing none, is the motion carried? Wonderful. Thank you, everyone. So we'll move on to item 7.5, Indigenous Health Rights and Reconciliation Annual Update. And we're very fortunate to have several public presentations on this item. So maybe I'll invite you all to come up to the chair, and we'll start with Joan Riggs of the Ottawa Aboriginal Coalition. I don't know if she's joining online or in person, but if there are any people in the gallery that want to come up to the microphones. Okay, we're going to try and track down Joan. In the meantime, we'll go to Stephanie Miki Adams. Would you like to go ahead? we'll move ahead to Connie Sadul. Would you like to go ahead?
Yep, thank you.
Thank
Connie
you.
Uyunga, Akasubik Inuit Family Health Team, Mingaktunga. I'm here with Lukta Dr. Indu Gambir. Thank you very much for the opportunity to share a bit of what we've been doing with you today. So we did prepare a few slides. I think we're going to, with the time, we're keeping it to just a sort of a snapshot of two main things. One are our mental health services and outreach, and some of our special responses that we've been engaging in the last few years. Can you see the screen okay? I don't know if it shows for you. Yeah? Okay, great. So the first slide shows you the vision of the Kasvik Inuit Family Health Team. We were established with the vision of improving well-being of Inuit with the respect and understanding of our community. This is through a responsive and culturally grounded model of excellence in primary care. I do find often serving a high-risk population, sometimes these services are regarded for whatever reason as kind of substandard or suboptimal, and when you're actually dealing with high risk, it's the opposite. A person has to be much more on their game all the time, and that's everybody, from the very first face at reception to whoever's picking up the phone all the way to physician encounter. We're 100% Inuit governed. Over the past few years, when we were first established, nobody ever thought we would see more than a few thousand patients ever, and it has far exceeded that, even as of year 3. We started seeing patients in 2011. So we took a snapshot of 1 week of incoming calls, and we get about, it's hundreds of calls a day, anywhere from 100 to 200 incoming calls, not counting our outgoing calls. So the incoming one, you can see that for that week, this summer, there were 14% of those were people asking to become new patients. In terms of our reach, you can see the hot map there. So we are of course, most of the concentration is where we have the housing developments and where we have most of our population living, but we do have, we service patients from each end of the city. We are constantly getting feedback and sort of in many different levels, so both formal surveys, informal feedback, as well as just on the fly. So you can see this one is the result of a survey that we just completed last year for our mental health programs, where we were asking, how have we helped you? And you can see some of the responses there in the slide. We do cover a comprehensive number of services, so it is primary care, but it goes a little bit beyond what is typically thought of as primary care, so there are support for social determinants as we see them. So we do provide that Band-Aid until we can link them up with an ongoing provider. And then we do provide a comprehensive amount of mental health services, including psychiatry, child, adolescent, adult, psychology, also for all ages, including neuropsychology and cognitive assessments. Psychotherapy, we have psychotherapy as well, and GP psychotherapy. Am I forgetting something? I'm sure I'm forgetting. Oh, and all the physicians take, even within the regular primary care appointment, a person can come in just to initiate that mental health interaction. These are some of our case examples. So of particular note perhaps tonight is we have always been there to assist and support someone who in their mental health journey. So case B is actually a patient that we encountered who had no previous diagnosis but had some fairly severe symptoms. We did manage to, with the proper assessments, ongoing support, we did help this person get through their treatment program and make that transition into transitional care afterwards. You can see cases A and C speak more to the model of care, so that in particular C, I actually knew that person. I would see her multiple times. Before we started, she would be in the ER multiple times a year, especially in the winter with respiratory infections. And then when we started, we managed to keep her out for a good 2.5 years. So that just speaks to that. In terms of morbidity and mortality, Inuit have a much higher morbidity and mortality for almost everything. You can look at any indicator, and even when compared with other high-risk populations like First Nations and Métis, one indication of that is the overall life expectancy. In terms of what we were seeing for COVID positivity, that's the next one. It's generally riding higher than the rest of Ontario for most times. So our responses, this is what we did. I think I might actually hand over part of this part to Dr. Gambier to walk you through that.
When COVID came, we knew this community is at high risk than a lot of other communities. So we had to think out of the box solution, and thanks to public health, they worked with us to find that out of box solution. And what we did was we set up testing at our site, because for this community to get anything in the medical system, the trust is the most important thing. So we set up there. We had a very small facility, and thanks to the planning department of City of Ottawa, I approached them. I said, we need to put a trailer so that we can keep our non-COVID patients out from our main examination rooms to this. So you see that trailer there. So we have that trailer where anybody with symptoms, we would swab. We have and then we will do the testing on site. And we not only did the testing on site, we also sometime would go to patient home, because there are. So this is, we will do the testing on site on the trailer, and then we have testing at our clinic. And if they were positive, we knew what next instructions we have to give them. We put the patient in the center, and then we decided we are going to build a wall around them. Anybody they come in contact with, they can come for testing so that it's not spreading for them. And same approach we used for COVID vaccine, so that anybody who has any contact with the person, a patient, can come and get vaccine. And public health, we were partners in this, and that's the way we were able to keep a lot of people there. But we not only did that, at that time, Ottawa is the referral center from Nunavut for any major problems, and they get treated. So I got a call from a public health officer from Nunavut, can you help us? Because at that time, the hospital will discharge the patient as soon as they can, and then the patient will be in a hotel for 14 days, right after that, and no medical care available to them. And what we did was we set up a hub team, and this is our hub team. They would visit, and initially we thought we will just go for 4 hours once a week, but it ended up 2 full days. And they saved many lives. They found people unconscious in the rooms. They had infections, so they did. So this is our hub team. And we were able to do this hub team because before COVID, we were doing visits to downtown shelters and patients. So we had, our nurses knew that, we had all plan what equipment we need to take it. So these are our doctor examining, and that what happened was stop the spread of COVID up to Nunavut, as well as patients who came there. So these are out-of-box solutions, but we were able to do that because we had good cooperation from public health to think out of box and provide these. Next one. We also did go to patients who were at their home bound with this hub team to do the swabbing as well as giving COVID vaccines to them. Yeah, you want to take it?
Yeah, I'll pick up the next one. One thing that you need to know for public health, the partnership successfully did reduce morbidity and mortality for Inuit during the pandemic years, and even currently during all of the respiratory surges. There hasn't really been any period of recovery, which we were anticipating since the beginning, right? We thought, oh, we'll have to do this for 4 months, which at that time seemed so long then, and here we are into year 5, I think, 4 or 5. So you have to know that, and one possible measure of that was, this is the Tertiary Referral Center for East out west in sort of Winnipeg. I think the first case of COVID making its way back up through a medical traveler was out that way, partly because they didn't have the same infrastructure that we had here.
I'll just, your 5 minutes is up if you wanted to wrap up.
Oh, sure. Okay, so you can see the ILI visits, right? This is recently for this year in terms of all the other stuff, respiratory, strep, all of those things. So the number of visits is quite high compared to comparatively speaking. So we've been catching all of that, and some of the responses that we set up during the pandemic will continue to that. In terms of where people go for help, that's the next one, and that shows that that's how we're able to sort of do some of the things we're doing. I must say there for Google, I'm always surprised that that's number 4, like where somebody would go to for their information is Google and the internet. And I think that's it. And then we have been collecting feedback, like I said, and that's some of the stickies that we are left with on our wall from people passing through.
McCormick, Miigwech, thank you so much, Connie and Dr. Gambier. I know the 5 minutes goes up quickly. Do any members have questions for our presenters? Member Bannon.
Thank you. So it sounds like kind of during the pandemic, there was a really strong relationship with OPH. And I guess I'm wondering, as we start looking into the future and what we're building towards the future, what kind of, from your perspective, the ambition for the partnership would be in the next, 3-5 years?
Yeah. I think we had good relationship from the beginning because we did STD, we did TB, so we all have a good relationship, and it has to continue in future, depending upon what is in horizon, which patients need, and also what is coming up. We need mental health, help with the mental health. We also need help with the outreach to the communities, drug and addiction communities. We also need help with the vaccination. And I have always said we also need help with some of the antibiotics and other things which people cannot afford to do and are for STI or something, those infections. So we are continuously need to be in support of each other.
That includes, I have to say that we've gone through the COVID times, and any of you who are around, those are crazy times. I mean, everybody's by the skin of their teeth, including public health. So part of the growing development is also being able to survive those times together.
Great, thank you. Member King?
Thank you, Chair. And I just had a question about demand for mental health services. I know with COVID and social isolation, there are a lot of challenges that many communities face. So I was just wondering about the demand and whether you're able to service the need for mental health services.
Yeah, the demand is always high. It's always full. As many providers as we can put on it, they're full right away. During these respiratory like the concerns with in-person care, we never closed even for one day, including with the mental health providers, which was quite a thing because the college, like all of the policies were in constant flux and what providers were being told themselves. So that was part of it.
I think the mental health has been our number one since we started it. The need is so much in this community, and our resources are limited, but we shared care model which we developed is not just referral to counselor, rather all physicians also take care of the in between their appointments. So it's a very different model of care. And because we never stopped in-person care, so the need is being met, but it's tremendous need. Resources are not enough, and our space is not enough. So we need that trailer still on our site to make sure that infections are, and then the rooms are used for mental health care.
Well, thank you so much. I appreciate the input. We're seeing that across the city, but I could imagine that it would affect the Inuit community acutely. And so it's impressive that these services are being provided. And I think that the response that we saw in your presentation also shows the appreciation for those services. We're also very appreciative of the services around immunization. I had noticed that Mary Simon, the Governor General, had promoted the immunization services, and I think that that's a very powerful statement and a powerful relationship in order to encourage people to get vaccination. So very appreciative of your work, and thank you so much for appearing before us today.
Thank you.
Thank you, Member King. I'm not seeing any other hands, but thank you so much for being here and for the important work that you do.
Thank you very much for listening to us.
Okay, we're going to move on to our next presenter, which I believe is joining us online, Heather Ochalski from the Canadian Centre on Substance Use and Addiction. Please go ahead.
Okay, wonderful. Thank you. Unuksakut. My name is Heather Ochalski. I'm the Director of Indigenous Partnerships and Strategies at CCSA, the Canadian Centre on Substance Use and Addiction. I'm really happy to be here today to add to the discussion on Indigenous rights and reconciliation, and specifically to talk briefly about the work we're doing with Ottawa Public Health and the Ottawa Inuit community. And it's so nice to see some of our Inuit Health Synergies members here this evening. Thank you for that presentation, Connie. I hope to capture the essence of our work, but if I miss anything after my presentation, I invite some of the Synergy members to add. So I'll just begin with the context. Ottawa is home to a minimum of 3,700 to as many as 6,000 Inuit residents, which is the largest Inuit population outside of Inuit Nunangat, the Inuit homeland, and continues to grow at a fast pace. There are several Inuit agencies that provide culturally based supports for Inuit who come to Ottawa for medical, educational, and other reasons, and for those who make Ottawa their permanent home. Recently, several emergent and critical challenges have been identified that require discussion and an urgent collaborative response. These include, but go beyond, community accounts of increasing mortality rates due to substance use, increased suicide rates in northern communities impacting those outside of their home territory or province, increased negative interaction with the justice and social service systems, increased homelessness and precarious living arrangements, increased isolation, mental health, and substance use, especially because of the continued impact of COVID-19 on the Indigenous community. Substance use-related child apprehensions, including overrepresentation in the child foster care system for other reasons, such as being at the lower socioeconomic spectrum and homelessness, limited access to education and employment. Many Inuit that arrived southern Canada have not had the same educational opportunities as the rest of Canadians, and graduation rates fall well below the national average. As many of us are aware, receiving a high school diploma and a post-secondary education are solid predictors of positive socioeconomic outcomes. For instance, receiving educational credentials are prerequisites to securing employment, income, housing, food, and social status that in turn affect health outcomes, identity, and pro-social behavior. We have responded to these critical challenges through what we are calling the Ottawa Inuit Health Synergy Sessions. Grounded in Inuit Kauyamaya Tokangit principles, the Inuit epistemological framework, CCSA and the Ottawa Public Health have partnered as allies to support Ottawa Inuit service providers in addressing the critical issues mentioned above, and with specific attention to the homelessness and the substance use crises that require immediate action in order to save lives. The group consists of leaders from a number of Ottawa Inuit service providers, such as Tungasuvinga Inuit, Inokatigi Center, Akau Civic Inuit Family Health Team, Inuit Nonprofit Housing, and Larga Baffin, as well as CCSA and OPH staff and other experts from the health sector, such as CHIO, national and regional Inuit organizations such as Inuit Tapare Kanatami, Nunavut Tungavik Incorporated as observers, and Paktutit Inuit Women of Canada. There is interest in engaging other urban Inuit organizations nationally who may be experiencing these kind of similar urgencies, and they will be invited in the coming days to join as observers. Our meetings are held on a bi-weekly basis, rotating between CCSA and OPH and the Ottawa Inuit service providers. While the meetings are co-chaired by CCSA and OPH, the discussions, direction, and proposed processes and solutions are led by our Inuit-led. Actions that we have taken, that have taken place so far and are in the planning phases include a SWOP proposal to strengthen the efforts that we're doing to work as a coalition, helping to the Inuit service providers identify and close service gaps, convening the Ottawa Inuit community to learn from people with lived and living experience, exploring further partnerships with other agencies. For instance, we already know that there are homeless people who need treatments, so we're exploring possibilities of partnering with treatment centers, because we don't want to create this expectation from people who, you know, really do need those needs and not deliver after engaging with them. And then we're also looking at cost-sharing exercises. Some challenges that have been identified by Inuit service providers include the unsustainable funding and competitiveness of the cost for proposals. And so these are some of the areas that we're addressing together, and we'll likely put a call to governments and funders to improve the funding formulas. So some takeaways for my presentation for you all here is that at CCSA, we're implementing the United Nations Declaration on the Rights of Indigenous Peoples Act. So what does that mean? It means that we're co-developing strategies with First Nations, Métis, and Inuit, and ensuring that they are Inuit-led rather than creating programs and by ourselves and then inviting the Indigenous community to participate afterwards. And as you are all probably aware, the Supreme Court decision upheld Bill C-92 recently, which is an act respecting First Nations, Métis, and Inuit children, youth, and families that affirms Indigenous nations have the jurisdiction over child and family services and outlines national minimum standards of care. And then, of course, we refer to the TRC's 94 calls to action and the MMIWG calls to justice in all the work that we're doing. So if you haven't learned about those important decisions yet or haven't read the documents, I encourage you to read them and implement them yourselves with your staff and your departments. And that concludes my presentation. I'm happy to take questions.
McCormick Miigwech, thank you for sharing with us. Do any members have questions for Heather? Seeing none, thank you again. Thank you for being here. We appreciate you. Okay. So unfortunately, some of our other presenters were unable to make it. So we're going to move on to the report that's in front of us, the Indigenous Health Rights and Reconciliation Annual Update. Do any members have questions for staff? Member Gower?
I don't have my notes in front of me, but I remember, or I recall one part of the report that I was interested in was the work that Ottawa Public Health was doing with local hospitals to address issues of racism, and we heard about that from a couple of presenters today. One of the barriers is encountering racism in the health system. Going beyond hospitals, is OPH engaged in any other activities around anti-racism training or anti-bias with other healthcare providers in Ottawa beyond hospitals?
I would say hospitals are the place we're starting, so we don't have anything formalized with others. Because hospitals were mentioned specifically in the Share Your Stories report, it was clear the community was identifying emergency rooms and maternity care as the places to begin as a top priority. Also, this work is early stages, collaborating across organizations. So the first step was to actually connect the people that are working to improve health services, to address racism that Indigenous peoples are facing in healthcare. And so that connection's been made. And one of the things we noticed is there is quite a bit of activity going on within different organizations, but people haven't been able to learn from each other or find out what's most effective or share resources. So that's part of creating this community of practice. Ultimately, the progress has to be judged by the community. And so that was also one of the early priorities we've identified. We don't have an answer yet, but we're looking to try to understand how we could collectively measure whether we're making progress in terms of what the community's experience is. And so we're looking for some recommendations so that different organizations aren't, all the different hospitals, Ottawa Public Health trying to engage with community and draw on their time as well to inform what we're doing. So that's really where we're at.
Okay, thank you. I was also going to ask about the follow-up, but you've covered that. The other thing that struck me several times in the report is just there's a number of mentions about challenges with resources internally at OPH, and I want to make sure I'm understanding because it also seemed like we have shifted some resources, or this year we'll be in a better position than they were last year in terms of having those resources available. Is that correct, or is there anything you want to elaborate on that resource shift that's happening?
Yes, so the hiring of 2 permanent Indigenous health specialists was recent, since our last board meeting. So that's additional capacity. So we will be looking to, share the work, look through the work, prioritize the work, but also for new input and new perspectives from people who are joining the team. And one thing I'm trying to emphasize for everyone at Ottawa Public Health is this is not the work of 3 people on the Indigenous Rights and Reconciliation team. They are experts. They have a lot to contribute to shape what the rest of us need to be doing. Yeah.
Thank you. Member Gower, Member King?
I think Member Gower beat me to the punch because I was going to ask questions about designated positions that were outlined in the proposed actions to advance Indigenous health rights and reconciliation. And notwithstanding the fact that we have those 2 employees, and notwithstanding the fact that you had said that the responsibility is wider throughout the organization, I'm just wondering if you could speak to the potential human resources needs around those designated positions, because in the action plan it does say that you want to continue to establish designated positions. And I think from the presentations that we've just received from partners, it's really important that we do have these positions to continue to build and maintain relationships with Indigenous partners. I think we heard directly from groups about the benefits of the partnerships with OPH. So I was just wondering, what does the future look like in terms of designated positions?
Sure. I think in all ways we'd like to represent, we'd like our workforce to represent the broader workforce population, be representative of the population in Ottawa. I'm just thinking about 4% is a the rough estimate of Indigenous populations, First Nations, Inuit, Métis, urban Indigenous in Ottawa. At times we've approached that. I don't know if somebody else online remembers what percentage we're at right now, if it's 1.8% of our workforce. So there are others who self-identify as belonging to one of these communities on our team, and I think that's what we want to see. The future would be that people are excited and bringing their lived experience and expertise to support all of our teams. And we do always ask ourselves whether certain work would be better carried out by Indigenous-led organizations. So I think that's an open question for our board as well, as we think about respecting self-determination. I'm very open, and this is where the partnerships with the communities, can continue to evolve and shape things. What services are we supporting that Indigenous-led organizations could offer? And there are examples where we're providing support, but it's a service in another organization. The vaccinations have been one, the dental clinic's been one. So thinking about that model perhaps in other areas. Does that answer your question?
Absolutely, I appreciate that answer, and I think it also aligns with the idea of the communities themselves identifying their priorities. And so I appreciate the answer and the work that's being done. Thank you, Chair.
Thank you, Member King. I'm not seeing any other hands. Oh, my apologies, Member Kavanagh. Please go ahead.
Thank you. One of the things that is outlined is the lack of consistent funding for these groups, which would be at the federal level. Are we going to make any, outreach to back that up to help these groups?
Yeah, that is one of our contributions, has been to support funding proposals of partners on many subjects, whether it's mental health and addictions or housing. It is behind the work of the Synergy sessions is to come to, convincing case of what actually needs to be in place and to look where those resources could be coming from. and what, again, this is where we try to uphold and support proposals that are coming from the community. So the Ottawa Aboriginal Coalition, for example, has good plans on housing. And so when we have an opportunity to speak to plans for housing, we indicate, and you need to consider this proposal from the Ottawa Aboriginal Coalition, for example. So that's part of what we're doing to make their proposals more visible. Yeah, but I think it's ongoing work.
So making direct asks to the federal government.
Yeah, and I think this Board of Health has as well. So again, I'm trying to think back to our mental health and substance use health report in November 2023. I believe the Board of Health actually supported a request for some funding for Indigenous-led services as part of that strategy. So I think you're on the record, and we'll continue to keep you up to date. And somebody did find the exact percentage. So last year, 1.4% of our team self-identified as Indigenous, and this year, first quarter, oh no, I guess it was the other way around. So 2022 was 1.4, 2023 was 1.6%, so slight increase. Not everyone self-identifies. I wanted to mention that part of getting to the future state is that it's a safe organization for people to show up in all of the different identities that people bring. So that's part of our work, is to make sure we're addressing the racism internally so people find it is a place they want to be. Yeah.
Thank you.
Thank you, Member Kavanaugh. I'm not seeing any other hands. Just do one more check online. Okay. I want to echo Dr. Etch's comments and thank the members of the Indigenous Health Rights and Reconciliation team for putting together this report, and more importantly, for all the work you're doing for our organization. So is this report carried? Thank you, everyone. Okay, moving on. Motion to adopt reports. Member Dudas, please.
The Chair of the Board of Health Verbal Report, the Medical Officer of Health Verbal Report, the Verbal Report on the Education Session regarding voluntary mergers, and the reports titled Indigenous Health, Rights and Reconciliation, Annual Update, and Attendance at the Association of the Local Public Health Agencies Winter Symposium be received and adopted.
Received? Great, thank you. Motion requiring suspension of the rules. We don't have any this evening. Any notices of motion? Seeing none. Confirmation bylaw, Member Dudas, please. So carried. Great, thank you. Do we have any inquiries? Seeing none. Just before we adjourn, I want to thank the Indigenous partners that joined us this evening and presented, and also those who were unable to join as well. Thank you very much for sharing your knowledge and your work with us. So with that, we are adjourned. The next meeting is Monday, April 15th, 2024. Thanks, everyone.